Medicare Advantage 2026. What's being cut, banned, and reduced. If you're on Medicaid Advantage plan in 2026, you may have noticed your coverage feels very different from what you had last year. Some people are finding out the hard way at the pharmacy, the dentist, or even the grocery store. What we're seeing this year is something I call a double squeeze. Changes aren't coming from just one direction. Seniors are being pressured from both sides at the same time. On one side, the federal government has launched a major crackdown on what is considered unnecessary or frivolous spending. On the other side, insurance companies are under significant financial pressure and are quietly tightening benefits to protect their bottom line. The result is a Medicare Advantage landscape where flashy extras are disappearing and even some core benefits are shrinking. In this video, I want to walk you through what has been banned, what has been reduced, and how you can protect yourself from unexpected bills. For the last few years, Medicaid Advantage marketing felt like a Wild West. You probably remember those commercials promising groceries, dental, cashback, and just about everything else under the sun. But that era is ending. For 2026, the Centers for Medicaid and Medicare Services, known as CMS, made the rule very clear. If a benefit does not reasonably improve or maintain your health or overall function, the government will not pay for it. Because of that standard, an entire category of perks have been eliminated. Plans are no longer allowed to cover items like alcohol, tobacco, or cannabis. While it may sound surprising, some plans were experimenting with allowances that could be used for these products. That is now explicitly prohibited. Cosmetic services are also out. This includes facelift, cosmetic Botox, fillers, other appearance-based treatments. There are medical exceptions such as Botox used for migraines or reconstructive procedures, but purely cosmetic services are no longer allowed. Funeral planning and funeral expenses assistance have also been removed. CMS made it clear that services provided after death cannot be tied to improving a beneficiary's health. Life insurance product and hospital indemnity insurance are also prohibited, since those are considered financial products rather than health benefits. Broad membership programs have been eliminated as well. This means no more Amazon Prime, Costco membership, or similar perks. CMS stated that these programs are too broad and cannot ensure that purchases are directly related to health or function. One of the biggest shocks for many people will happen at the grocery store. Unhealthy food is now officially excluded from grocery allowances. If you previously used your food card for items like soda, chips, or frozen desserts, you may see transactions declined in 2026. CMS defines unhealthy food as food that does not assist in meeting the nutritional needs of a chronically ill enrollee. However, they did not publish a specific list. That means that each insurance company must decide what is allowed and can be prepared to justify those decisions. This change is a part of a broader government trend. Similar restrictions are appearing in programs like SNAP, where some states are already banning soda and candy purchases. Across multiple programs, the government is sending a constant message that will no longer be subsidized on unhealthy food. It is also important to know that this specific food restriction was not even in the original proposal. It was added later after public comments raised questions about nutrition. That's a reminder that public comments during rulemaking periods can actually influence financial decisions. Those government changes are public and visible. The second part of the double squeeze is harder to spot. Insurance companies themselves are also cutting back. There are also 20 1,000 Medicaid plans nationwide, which makes these changes difficult to track. Industry experts refer to this as mid-year fade. Reimbursement rates are tightening, but insurance can easily raise premiums. Instead, they reduce value by limiting access, narrowing networks, or adding restrictions. Reports indicate that fewer plans are offering over-the-counter benefits, meal programs, transportation, and remote access. Even when these benefits still exist, the fine print makes them harder to use. There are several shrinking benefits you should check immediately. Over-the-counter benefits are one of the biggest changes. Last year, your allowance may have covered a wide range of items at local pharmacies. This year, many plans restrict purchases to specific products or force you to order from the limited online catalogs. Even if the dollar amount didn't change, the value may be much lower. Dental benefits are another major issue. Many plans still advertise dental coverage, but annual maximums are shrinking and the networks are tightening. A dentist that was in-network last year may no longer be covered. Some people only discover this once they're already in the chair. Transportation benefits are also being reduced. Some plans are limiting rides strictly to medical appointments. Trips to the gym, grocery store, or other non-clinical locations no longer be covered. Meal benefits are also changing as well. Post-hospital meal programs still exist, but the triggers are stricter. Some plans now require specific diagnosis before meals are approved. Fitness benefits are being scaled back. While standard gym network specialty fitness programs are often being removed in favor of basic gym access. Finally, the Part B giveback is shrinking. Many plans still advertise it, but it's a growing number now, often very small amounts that can be offset by higher copays or other costs. So what can you do right now? First, never assume providers are still in network. Before appointments, call both the provider and your insurance plan to confirm coverage. Download your plan's catalog. Know exactly what is covered and where you could shop. Third, if you were promised benefits during enrollment that are not realistically available in your area, you could file a formal grievance with your plan. If all of this feels overwhelming, you don't have to navigate it alone. Medicaid plans are complex, and the fine print matters more than ever in 2026. Getting help from a knowledgeable medical advisor, Medicaid advisor, can make a real difference in understanding your coverage and avoiding unnecessary costs. I'll be back soon with more updates to help you protect your benefits and make informed decisions.